Hi, I'm Efrain. I'm a surgery resident at Geisinger. Here are our disclosures for the last 3 years. We have a couple of our authors who reported some compensation, specifically with Intuitive, which is one of the subjects of this research. So for background, Intuitive Surgical provides robotic platforms for about 60% of the world market. Robotic cholecystectomy has increased from 2.6% in 2017 to 7.7% in 2020, which is interesting because there's an absence of data written by authors not employed or paid for by Intuitive Surgical that is focused on meaningful surgical outcomes. Robotic cholecystectomy has been shown to have worse quality outcomes than laparoscopic cholecystectomy, which is the current gold standard. Data uniformly demonstrates higher costs and longer operative times. Just to give you some background on the money side of things, in the years that we started tracking this data through open payments, there's been over $300 million that have been distributed to hospitals and physicians. 72% of that has gone in like direct compensation and education. And there's an increasing trend. There was a small dip in 2020, but overall the amounts have been going up. And like I said, it totals up to like $322 million. And then in 2022, which is the last year that we have data available, it was about $53 million to physicians alone. So our research question was, are conflicts of interest disclosures accurate in manuscripts examining robotic platform for use in cholecystectomy? And do the industry payments influence the author's conclusions when examining the robotic platform for use in cholecystectomy? Our data sources, we use PubMed and the Open Payments database. So we did a search of PubMed for manuscripts that had the words robot and cholecystectomy in them between 2019 and 2022. And then we used the Open Payments database to collect payments on all authors. And then we also checked for like the conflict of interest disclosures, payments 1 year prior and 1 year after the publication date. There were 231 publications that we found and 192 exclusions. And the exclusions were based on like unrelated to, manuscripts unrelated to robotic cholecystectomy, non-US authors or AI or other platforms, concurrent operations, like if they were part of like, oncologic or Whipple procedures, animal models, and we ended up with 37 publications we looked at. Then we had 2 reviewers who were blinded to the open payments data. And they independently reviewed the manuscripts and rated them as in a scale, strongly, mildly, neutral, from unfavorable to favorable. Then the conflict of interest disclosures and their adequacy was then verified against the reported payments by 2 other separate authors. And then we used statistical analysis using that software. And then here are the trends that we found. These are like different questions that we asked. So like, did authors receive payments? There was not really a trend there. Did they disclose a potential conflict of interest with the manufacturer? Not really a trend there. But was there a conflict of interest? Well, if they were receiving payments, then it was more likely that the answer to that question was yes. And then the next question is, was then the conflict of interest disclosure adequate? There's not really a trend there. Now, with regard to the magnitude of payments, we found that the higher the payments, the more likely that they would have strongly favorable articles. And then lastly, did they receive additional payments like the year following? I didn't really find a trend in that. So for our conclusions, we found that over half of all manuscript authors did not adequately disclose a conflict of interest. And then authors with as I stated before, authors with a conflict of interest with the manufacturer were more likely to publish favorable robotic literature. And then authors receiving higher compensation were also more likely to produce robotic favorable literature. And for these reasons, adequate disclosures of conflict of interest remain problematic in peer-reviewed literature. Of course, peer-reviewed medical journals and societies should require inclusion of the most recent payments data with submission of scientific studies. Authors must be responsible to disclose. Oh, sorry, I think I'm getting a. Authors must be responsible to disclose the conflict of interest between the most recent payments and publication of scientific studies. And for these reasons, really, the audience should be provided actual payments information, allowing them the opportunity to generate informed opinions in light of potential bias. And this is, of course, so that we can have good research, that is focused on the patient. Any questions?